Okay. Hi, everyone. I'm really glad to be here and speaking and interacting with you guys. I'm Dr. Tehrani, pediatrician. I studied internal medicine, but I went into the practice of geriatrics. And the reason I did that, I just felt geriatrics as a specialty, as a whole, um, we can take better care of seniors, and they need more guidance. So we created a clinic that kind of helps patients on every step of the way and is very responsive to patients. As and people ask, how did I end up in the assisted living? And I you can get a little background behind me, and then we'll get into the topic. As our patients got older and some of them moved into the assisted living, we followed them because they asked us to follow if we can follow them, and we did. And as we went into the assisted living, we followed our own patients. They started asking if we can follow others. We saw such a need for it, so we started developing a program, assisted living program that cares. And basically, we just cater to the needs of the patients, and we try to do how to make the lives of the patients easier and happier. And as our patients got a little bit had higher need for the assisted living, they moved into a boarding care. And can you follow us into the boarding care? And so we did. And then one patient, we gave them patients, they gave us patients, and and here we are today. The coronavirus, I go to the hospital, although my focus is not the hospital, my focus is clinic and the assisted living. I go to the hospital sometimes, but I'm very in touch with hospitalists because I work with hospitalists. When my patients get hospitalized, this is the team I choose to work with, and each hospital has their own a team that I work with closely. It's nothing like they've seen before, from what they tell me. The thing virus separates it from every other virus or every other thing we have is it's very rapid. Meaning, you go from being good to not good really fast within an hour. Other viruses don't present like that. You have a time to intervene. You decline like this. You don't suddenly decline. Coronavirus, you suddenly decline. That's what makes it different than other viruses. When you suddenly decline, we don't have a chance to intervene. And when we do intervene, we can beat the virus. The virus causes way too much damage. When your body slowly takes a decline, as your body is declining, it's also regenerating. It's also fixing itself. So the virus is breaking you down slowly, but your body is beginning to build itself back up slowly. So there is that balance. But with the coronavirus, it doesn't give your body an opportunity to fight. It doesn't give the doctors an opportunity to fight. And that's what makes a difference. It goes in your lungs, and then it destroys your lungs really fast. You need your lungs to breathe. So when your lungs are completely destroyed really fast, there's only so much a breathing machine can do too. You need your lungs. A breathing machine is like a cane. You still need your feet to walk with the cane. A cane is useless if you don't have your feet. It's the same concept when it comes to coronavirus. It so quickly destroys your lungs that we can't do anything. You put them on a vent, it can't do anything. So that's what makes the coronavirus different than other viruses. What else makes coronavirus so different? It's highly transmissible, meaning if you breathe in just a few particles. It's enough for it to affect you. Whereas other viruses, it's not so highly transmissible from one person to another. It is transmissible, but not so highly transmissible. The other thing that's unique about it versus the influenza is it has a higher percent, it kills at a rate of about 3% of all those infected. That's pretty high. That's a pretty high rate. What affects doctors the most from a doctor's perspective and a nurse perspective is that you're not given a chance to intervene because everything happens so fast. Emotionally, that's the biggest hit on doctors, is that you don't have a chance to intervene. Right when you come to do something, you have a crashing patient, and young people are affected. So are older, but so are younger. So this whole thing that it only affects older people, yes, it is true, but younger, I already have people close to me getting affected. A high school friend of mine got affected. It's getting closer and closer to home. It's getting closer and closer to home. Ultimately, what I want to get into is in the Long Beach area, the rate is a little bit higher. And because we're talking to a lot of people that here are caregivers, or they are part of a community setting, I want to talk about how we can protect your community and how we can protect communities, because it's like rapid fire. If one person in a community gets it, it easily transmits to a lot of other people. So prevention is very important. So let's understand a little bit about how viruses in general work. How are viruses different than bacteria? We always say viruses are not live. They're not alive. Then if they're not alive, then how are they living? How are they going around infecting people? The reason why, when we say something live, we mean this by live, the definition is it can live independently, like humans, like bacteria. We can live independently of someone else. A bacteria can live independently of someone else. But a virus, in order to live, it needs a host. Think of a host at home. It needs a host to live. Otherwise, it doesn't. If a virus does not have a host, it doesn't. It's individually alive, so it needs a host to live. Some viruses infect animals, and the host becomes the animal. So the virus in humans, the virus needs our body to be able to replicate. Without us, it won't replicate. It doesn't have its other piece. So this is why we say, if we don't give the virus what it needs, which is the human body, it's gonna die off. When a virus infects you, it begins replicating in you. And there's only two ways this virus there's only two end results with this virus. Either this virus, we build an immunity to it and we fight it back and we kill it, and then the virus is dead. Or if the virus kills us, if the virus kills you, then it killed that host that it replicates in, and then it doesn't have a host to replicate in anymore, and then it itself dies. So that's why we tell people, don't get exposed to it, because the moment it exposes in you, it's going to now it has somewhere else to live and somewhere else to live. In China, the reason why you see the curve is flattening is because they took very aggressive measures of isolation. They took all the people that are affected and they put them in one place. And then either those people built immunity to it and lived, or the people died. But either way, the virus was not able to get out anymore to other people, and then it began to fade away because the virus, it could not infect new people, and the viruses that were there, either they killed the person and they died, or the body built immunity to it, and it killed the virus. Nonetheless, the virus began to decline. We need to do the same thing in order to flatten, or what we call flatten the curve. Now, because it spreads like rapid fire, we have to be very careful. We don't introduce it to people that are confined. The reason why New York has such high rates, it's several folds. One is the train stations. You're so condensed. New York is everyone comes and travels through New York, so you have a lot of people coming into New York, leaving New York. So that's why it's the epicenter of this. But so what that tells us is any enclosed space, this virus is gonna, like a ping pong, not a ping pong ball, but not a ping pong ball, but that game where you pull the spring and then the ball jumps up and it hits different things. It's the same concept. The moment the virus touches you, it infects you. And the closer, the more compact area, the more people it's going to affect. What looks like New York here is our community livings. Ton of people in pinball machine. Thank you. From Andy Hone. The pinball machine. Just think about the pinball machine. The ball goes out. The more device you have, the more it's going to hit. The less areas the pinball has, the less areas it's going to hit. Now, each place it hits, that place becomes an infected ball too, and that also begins to hit other people, and that's how it spreads. So in a community living, how do we reduce the chance of it happening? This is why in a community living, you never hear just one person got it. One person gets it, many people will get it. So preventing it from coming to your community is key. Now, how do you prevent it from coming into your community? Well, we're doing a lot of this stuff already. We're preventing people from coming in, so people cannot bring it in. We're checking temperatures and all that good stuff. Another area where we're doing really good at is, or one area we have to focus a lot on, is try not to let people out of your community to go to the hospital. If they go to the hospital, they will get it and they will come back and spread it to everyone else. The hospital is the hub of the virus. When you're standing in line to get checked out so you can get screened behind the tent, you're standing there between all the other people that have the corona, that may have the coronavirus too. So we, as physicians, we have to really now decide, before we send someone to the hospital, is the benefit greater than the risk? Facilities have protocols. Someone falls and they hit their off, they go to the hospital. Now it's not they go to the hospital. You have to decide, is it better to take the risk the person may have a chance of bleeding in the head, or if I send them, they're going to come back with coronavirus? Is that risk higher? Which you have to weigh your risk and benefits. And honestly, for me personally, like, I have a conversation with each family member and I say, this is the risk if we send them to the hospital. This is the risk if we don't send them to the hospital. And most of the time now, we have decided against the hospital. These are otherwise would have gone to the hospital if we were not in the situation we are in today. Yesterday, we had another patient that ordinarily this is someone that would have gone to the hospital. But we told the family that if she goes, this is the risk. If she doesn't go, this is the risk. And so we make decisions like that. And again, if we send one patient If we send one patient, you're risking that one person getting it, and when that person comes back, there's a high risk of giving it to other people. I mean, how much precautions can an assisted living or nursing home take to prevent it from going from one person to another person? Do nursing homes have all the gear? We were afraid that the virus can enter your body in 3 different ways. Either you eat it, your hands are dirty, your hands are infected with it, you put it on food and you eat it. That's one way of getting it introduced into your body. If you touch your nose is another way, or your eyes. These are the 3 areas really that it enters your body. So that's why we wear a face shield to protect our eyes. We wear a mask to protect our nose and our mouth. We wear a gown because the gown you can dispose. But if the virus is on your shirt and you touch your shirt and you scratch yourself, now it's on your hand. And if you forget to wash your hands and you touch your mouth, then it's in you. And then gloves, because gloves you can dispose. You can dispose those fast too. So does the assisted living and the nursing home have all of these to be able to really take care of a coronavirus positive patient? We're in a tough spot. Okay, what if we don't bring the patient back from the hospital? Let's say we have a patient in the hospital and we don't, and the nursing homes, they start getting infected, and one person infects 7, 8 people, and all these 8 people go to the nursing home, go to the hospital, and they are medically clear now. They're clinically better, but they still have the virus. So what do? If you keep them in the hospital as stable patients, there they are. They're taking up a bed. They're in the med-surg unit. They are exposing themselves to other infections. But okay, put that aside for now. But if I cannot open up a med-surg bed, that means I cannot downgrade my ICU patient who's now been stabilized to medical surgery because there's no beds available. So the ICU patient will stay in the ICU, taking up a bed there. So here I have a patient now in the emergency room. The emergency room wants to send the patient to the ICU so they can open up their bed. But if there's no bed open in the ICU, then the emergency room can't move a patient from emergency room to ICU. And if you can't open up an emergency room, but how are you going to tend to the next person in the emergency who's crashing in your ER waiting room? So you see the domino effect. So if our nursing home or assisted living start getting infected, it's going to cause a really big problem because we're going to send them to the hospital. We're going to be hesitant to take them back because if they come back, they're going to infect all the other people. And it's just, and this is what we're afraid of is part of it is not having enough vents. But this is why a few weeks ago or a week ago, I put a picture of communities putting hospital beds in them, because we are going to get to that point where we will, when you have a med-surg patient who's stable, but the facility won't take them back, you have to move them somewhere to open up that bed so you can put the next person in it. So one of the biggest things I can say is do everything you can to prevent that one patient getting it. Reduce the risk of that one patient getting it. Ask yourself always, I know ordinarily I may have sent this patient to the hospital under different circumstances. Do I need to send it now? Question your doctors. Do I need to send this patient? Do I need to send this patient to the hospital? And that's the biggest thing we've been doing with our community livings is just question if the patient really, really, really needs to go and If we can do it under close observation, then we'll do it under close observation. There is no guarantee. There is, the families understand the risks of staying there. Like when I talked to my family yesterday, I said, if we send her, there's a chance she may get the virus. If we don't send her, there's a chance she may go into septic shock and die. You're taking a risk on both, but which one is going to be less of a risk? Remember, we're never going to have 100% right answer this time, and that's another thing that's hard for physicians to accept, that you won't have 100% answer. My decisions right now, it's 65, 35, 60, 40. I'm taking a 40% chance by keeping them, a 60% chance by keeping them. But everything I have to decide comes out to a 60, 40 decision. And that means half the time I'll be right, and half the time I'll be a little more than half the time I'll be right, and some of the times I'll be wrong. But this is the era we're in right now, and prevention is key. And that's it.
Okay, so personally, how do you feel about this, about people not taking it seriously?
When people don't take it, I mean, I don't know why people don't take this seriously. Like, it's because, they don't take it seriously because the same way we don't take prevention seriously. Like, do you think every person that got a stroke and is now paralyzed, do you think they took all the preventative care? Because if we don't see something, it doesn't exist. And that's the mentality. This is why our preventative care is so poor, because it cannot happen to me. It won't happen to me mentality. We have to understand that if we don't take this seriously, there's going to be heavy consequences. It's just like as a young person not taking care of yourself. There's going to be heavy consequences afterwards, but the consequence is not just you. You are going to affect the people that you live with. You're going to affect other people. Whereas if I don't take good care of my health, I'm going to kill myself, or I'm myself going to be disabled. Now I'm going to affect other people too. So we have to take it seriously. Like 1,000 people I think died yesterday in
Yes, yes.
Like, it's something really serious, and every day it's getting worse. So I see people taking it more seriously from what I see, but it's serious. Like, it's serious.
All right, so let's move to questions and answers. So raise your hand and unmute yourself at the same time that you're going to ask a question.
Now,
all right,
real quick before I do, because I know this will probably be a question by several people.
Sure.
Face masks. What should I do about face masks? Again, remember, we are in a war zone. In a war zone, it's kind of like you're hungry. You're starving. If you're starving, you're going to eat things that you don't ordinarily eat. You're going to eat things that are, like right now they say, what happened to all, like, you're going to eat things you would not ordinarily eat because you're in a starvation mode. You're in a state of survival. Mm-hmm. It's the same thing here. We have to use what's available to us. If we have an N95 mask, the best, if you have one. A surgical mask works a little bit, not as good, but it's better than nothing. Then I get asked about, what about a scarf, or what about a homemade one? Well, it's better than nothing. It's not as good as an N95. It's probably not as good as a surgical mask, but probably at par or pretty equivalent to a surgical mask. But if a bandana is all you have, then use a bandana. It's better than being completely naked. Does it work? I don't know. I don't know if the virus is small enough to go right through it, and it's not, The concern, some people say the virus is so tiny that it's just going to travel right through the fibers and go. We don't know. We don't know we don't know these things. We can speculate, but until we get answers, it doesn't harm to wear a mask. The benefit of wearing something is greater than nothing, we think. So let's wear that. I got a question about how long can you wear an N95 mask? Okay. Same concept. If you don't have a lot of N95 masks, then having your one is better than not having any at all. So hold on to it. As long as it's not contaminated. If it's contaminated, then you have to throw it out. But if it's not contaminated or it's not deformed, if that's all you have, it's better than nothing. So do that. Again, we're in a state of unknown, and that's why we're constantly changing our decisions, because every hour we learn something new. And remember I said it's 60-40. That means 40% of the time we're going to be wrong. So whereas we told you don't wear masks, we're going to tell you, oh, you know what, we were wrong, wear masks. But it doesn't hurt to wear a mask. Just wear a mask. We don't, if you have a N95, if you don't, wear surgical. If you don't have surgical, wear a bandana. Keep the distance. Why? Because the virus is probably not going to jump from here to 6 feet. Usually it's about 2 feet when you sneeze, or 3 feet, but keep it safe. Keep a 6 foot distance. But this virus does affect everyone. It does affect everyone. It does affect young people, old people. I've seen a 6-month-old just died from it. So it's different.
Okay. All right. So let's move to question. Christine, you have a question?
So if there are known positive cases in a community, are you recommending that families move their loved one out and maybe bring them home if they can take care of them, especially since there's so much unknown around this?
My recommendations are yes. If you have the capability or the capacity to take care of your loved ones safer at home, where they're exposed to less people, I think that's a better decision. The more secluded, the more isolated, the better. Some families can't take care of they can't take care of their loved one. But if you can, I think it's better to just temporarily move them out so that they can be more secluded. Again, like the pinball machine, it's so perfect in my mind, where you have the little pins and you have the ball, and that ball is just bouncing around, and everything it touches it infects it. And we humans are a pin. So if you take yourself out of harm's way, the chances of you getting it are going to be less. So it's just taking yourself out of harm's way.
Okay, great. We have Allison. Allison, do you have a question? Are you there?
No, I don't have a question. Thank you.
Okay, all right. Anybody else has a question?
Fredy, it's Lorene. Doctor, some of us had what we at the time from December through January, a really bad case of the flu this year. There's some talk that may have been the coronavirus that came here to California early, and some of us may have already had it and may have antibodies. And I know that there's tests starting along that line in some areas of the country or the world. Are you familiar with any of that, and what do you think about it?
I think it's good to get tested for antibodies because, a lot of this virus presents the same. Between virus to virus, there's a lot of overlap. Like, when you see viruses, there's going to be this much overlap and this much difference. So there will be, and whether you had it or you didn't, there's only one way to know, and that's really to do the antibody test. I would recommend doing the antibody test because if your body built fighter cells one, it gives you a peace of mind. You know what? I got it. Chances of getting it again are not as strong. But also, if it comes to a point where it gets really bad, we are taking people's blood and taking out the plasma, because in the plasma, you have those fighter cells that fought and killed the virus. You can be a donor. If you know you're positive, you can be a donor, you know, to your, if you know someone that's fighting it and is in critical condition. There was a study where 5 people were vented in the hospital for 30 days, vented, and they gave them the plasma, which means blood from someone else that had someone that was infected, and their body built fighter cells or immunity to it. They gave it to those 5 people. 3 of them, within a few days, got better, left the hospital, they're home. The other 2 are extubated, and they're on the med surg floor. So I think you never know who is going to need plasma, but it's good to know who is positive so we can help those out that need it. And if you don't know if you're positive or not, then you don't know. But if you know you're positive and you have it in you, then you can be one of the first line people to donate.
Okay, great question. Anybody else? Okay, Russell, go ahead.
Guess I got multiple questions here. On the plasma, how do we know that it's safe to take that blood, you know, not getting infected with other diseases like HIV and stuff like that? What are your thoughts on the malaria drug and the Z-Pack combination and things like that? And the last question is, should we be washing our groceries off, disinfecting our groceries when we come back from the grocery store?
Good question. So your first one was about plasma. Well, it's the same thing when we do blood transfusions. It's really low. I think it's like the chances of something are like 1 in a million, or even lower than that. Everything is a risk. When you're at a point where you're critical and you're going to die if we don't do something, it's better to give you something than you dead. It's better you be alive with HIV than be dead without HIV. So we're not using this plasma as a first line resort. It's kind of like a last line resort that we give it. It's you're intubated and your survival are diminishing. You're not going to survive if we don't do something. So it's a last resort kind of thing. But in general, we can spin out all that stuff out of it. With everything, there is a risk. What was your second question? I knew the third one was about the grocery. What was your second one?
What are your thoughts about hydrochlorine? I can't pronounce it. You know, the malaria drug and the Z-Pack combination.
Right. So there was again another small study. These are all small studies where they gave it to people, and they first gave the chloroquine initially. The patients, they started improving, but not improving so fast, but improving. And then on another person, you know, they gave a Z-Pack because they also had pneumonia. They saw a sudden decline. So they are giving. They're saying it works, but is it 100% of cases it works? No, there's people that are giving it and it's not working. So is it 100% answer? It's not. But again, when a person is in a critical condition, we are going to throw at them everything we have, because that's our last fighting chance to bring our patient back. And you're going to give it everything, because at the end, you don't want to say, if I had done this, what if I had done that? So you're going to give everything you can. So if I have a patient, would I give them that? Yes, I would give them that. I would give them plasma. I would give them everything. You know, there's another talk about vitamin D, zinc. What was the third one? Vitamin D, zinc, vitamin C. Do these work? Again, there's, you know, some doctors swear by it, but there's no research, there's actual research behind it. There's one doctor I know, he swears by zinc. 50 milligrams once a day, vitamin C, 500 grams once a day, and vitamin D, 50,000, which is the high unit. If I got it, what would I do? I would take those 3 pills, the vitamin C, vitamin D, and the zinc. If I got hospitalized, I would tell the hospital, hey, give me the Z-Pack. I'll probably take a Z-Pack too. But if I got hospitalized, then I would say, give me the chlorine. And if I'm intubated, give me the plasma. But these are all, one doctor says he's at work, they say do it, but we don't have definitive answers. Now regarding the groceries, of course, like this bug, I touch this, let's say the bug, I get this from someone who had the bug on their hand, the bug is on this now. I touch it, it's on me now. I touch a peach and I see the peach is not what I want, now it's on the peach. Because we don't know when is the last time the person touched it, we don't know how long the virus really lives, just assume the virus is on everything until you clean it. So groceries, clean it, because you never know. There was this person, this nasty person that was spitting on groceries, and the video caught it. How many people did it that the video did not catch? Like, think about how many, when something is caught, imagine how many things go on that is not caught, that we caught one of it. So assume, there's no risk in washing something. So just, always assess risk and benefit.
Okay, great. Thank you. Those are great answers. Anybody else? Another question? Oh, I see. Stacy has a question. Stacy, you posted a question there on the chat room. Can you hear me? It's Stacy. No? All right. Anybody?
I have a question. I can hear you, Fredy.
Okay.
Oh, sorry.
All right. Who has a question?
I think I was muted. Yes, this is Stacy. I just had a follow-up question from Russell's question. Is it important to not take the Z-Pack and the anti-malaria medication as soon as you get sick? Would that benefit you? My daughter, I have a daughter home from college, 19, who was exhibiting a slight fever and a really bad sore throat and some congestion. And of course, we were watching her like crazy, did a telemedication call, and they're treating her for strep throat. And, we're keeping an eye to make sure she doesn't get additional symptoms. But if she did, wouldn't it be important to start those drug therapies earlier rather than when they were at the point of possibly needing?
So for me, I would start the Z-Pack. Like, if I had my concerns, I would start Z-Pack. I wouldn't go anything stronger than that unless I was on the verge of going to the hospital. But if I was to feel short of breath right now, a little bit, not enough. Like, if I was still able to carry out my activities and I suspect I have it and I'm having a little bit of cough and sore throat, I would start myself on Z-Pack. I would take the vitamin D, the zinc, and the vitamin C, and just leave it at, and then just see how things progress from there. Still, remember, only 3% of people die. 97% of people still, they do well. So we're just trying to reduce your 3% to even less than that by giving you these medicines. Now, if you have it, your immune system is trying to fight it off. Now, if you go out and you get exposed to the influenza virus or a bacterial virus, then now your immune is even weaker because it's getting hit by another virus or bacteria. So now your immune system is weaker and it can't fight as strong. So if you think you have it, then super isolate yourself. So catch something else so that your immune system doesn't get occupied with something else while it's trying to fight this. But I would start a Z-Pack. I actually had my first patient with COVID, unfortunately, and was part of a nursing home, not a nursing home, it's just boarding care. And there was 4 people in that boarding care, and somehow someone got it, but my patient had presented with a little bit of productive cough, nothing really much more, no fever, but just being on the safe side, I started antibiotic. Then a couple of days later, we heard, not a couple of days, but there were other people kind of coughing too, and we thought maybe, it's nothing. But I started my patient on antibiotics right away. And there was another patient there that was a hospice patient. He was on antibiotic before for something else. And the patients, out of the 4, 3 got hospitalized, and 2 of them died. They were not on any antibiotic. Mine was hospitalized, not that she wasn't doing well, out of abundance of precaution. And that this was early on. This was like this was like early on. This was one of the very first cases. But mine survived it, and so did the hospice, was on antibiotics. So from my experience, I would start the antibiotic early on. Is there any proof or data or studies behind it? No, but again, we're in war zone, and we're gonna, everyone's gonna do what they feel. It's gonna be survival. So that's what I would do.
Okay.
Fredy, can I ask, Doctor, which antibiotic you started and why you chose that one?
So for me, when I look at antibiotics, to me, Z-Pack, I would give it to an otherwise young and healthy person. And I would give Levaquin to someone who's older with comorbidities or risk factors. I started my patient on Levaquin, but the studies that I saw, they put the patient on Z-Pack. I don't know if it's Z-Pack or it's mine was on Levaquin and mine did fine. And if it was me personally, I would probably put myself on Z-Pack. But on an older individual with comorbidities, I feel Levaquin has a bigger impact. Now, does that mean Levaquin is going to be stronger in younger adults? No. Z-Pack, I feel it targets the bugs really strong, but it doesn't cover the broad spectrum of bugs. Whereas Levaquin, it doesn't hit as hard, but it covers a broader spectrum of bugs. And because seniors live in communities and they're exposed to a lot more, chances are they're exposed to more things. And so Levaquin to me is a better choice. But again, there's no data or studies behind it other than my personal experience.
Okay, any other questions? Dory, supposed to you have a question?
So my question is, assuming that we already have, community spread happening at skilled nursing facilities, assisted living facilities, RCFEs, how are doctors preparing patients to discharge home? And do you think that Medicare is prepared to offer additional home health services? What are you seeing now, and what can we expect in the coming weeks? Because we obviously are going to see way more people having to be at home with additional services.
Right now, what I see is everything is just frozen. Nursing homes are not letting anyone in, they're not letting anyone out, or no one is going out, no one is coming in. I think we'll see what happens in the days to come. But I think one of the biggest challenges we're going to have is your patient goes to, like my patient went to the hospital and recovered after 2 days. Satting fine, doing fine. just like any other, you get it, you're fine. But here we are keeping her in the hospital for 14 days because the facility won't take her back. Because they're afraid if she comes back, she's going to infect other people. Okay, reasonable, that's reasonable. But here we are, we're keeping her in a hospital for 14 days and do 2 tests that are negative before she goes back. But then the government does not want to do those 2 tests. So then the facility says, I won't take her back without the 2 tests. I mean, both sides, we don't have enough tests to test other people. So here we are to do 2 tests to confirm someone is negative when you don't have enough for the other one. Okay, I understand the government's perspective. But I also understand the assisted living's perspective, that if I take her back, the patient is a wanderer, she has dementia, she walks, she wanders from room to room, and she's going to go get other people infected. How are you, as a facility administrator, going to justify it to the other families that this patient, we took her back knowing she was positive, and she infected your mom and your mom died? Like how? So I understand both sides of it, but it's like homelessness. We don't have an answer right now. I think we need to put all the people that got it on until they get better, particularly, especially like the ones from nursing home and assisted living where they're exposed to a lot of vulnerable people. We need to find an assisted living or somewhere that will take all these positive people, hold them there until they become negative and safe to send back. And that's that missing link that we're missing right now.
Yes, and actually what I noticed too is a big spike in the skilled nursing facilities, but also the state of California is ordering skilled nursing facilities to take patients with coronavirus. So what do you think about that?
So again, it's, we're back to the 60-40 thing. Do we keep them in the hospital and let the crashing person in the emergency room crash because we don't have a bed to give them? Or do we say, take your patient back, but just do strict precautions? And I think given these 2 choices only, right now, we have only these 2 choices. Mm-hmm. Keep the patients there, fill up the beds, not have another bed for that crashing patient in the emergency room.
That's true.
Or take the patient and do the best you can to prevent others from getting it. I mean, if every one of you had only these 2 choices to pick from, I think you would pick the second choice of send the patient back and do your best.
Yes, correct.
A lot of people that comment on this, they, you saw an outpour of angry people come out when this came out and the government said this. We can complain and complain. I would love to hear the people that are complaining. It's about the choices we have, not the choices we want. There's a lot of choices I want. The bottom line is, what are my choices? And today, my choices are send and protect as much as you can, or let someone else crash in the emergency room. And mind you, that crashing person can be you, can be your loved one, someone that we could have saved, but we did not save because we didn't have a bed available. I mean, that's they're both horrible. You're deciding between horrible and more horrible. And ask yourself, if these were my only 2 choices, what would I pick? And I think everyone would pick just send the patient back and do the best we can.
Okay.
Unless you have another idea.
No, there's basically not, as you said, there's not that many choices. All right. Anybody else? Any other questions?
I was just going to say, and perhaps start the antibiotics you suggested with the patients that you send back.
Right. So these patients have been treated, started on antibiotics, and they're gonna come back with it. But you're still taking a risk. Like we're not gonna send back to you someone that's coughing and sneezing. We're gonna stabilize it from that perspective. But is it still going to be in them? Possibly. Are they going to have a tickle in their throat and cough? Possibly. And when they tickle and cough, will it come out? Possibly. So there's so many possibilities that may happen, but but we're not going to send back someone who's actively coughing or sneezing. We're going to send someone back who's stable. We're going to put a face mask on them so that even if they cough, it's going to get caught in the face mask. So the risk is, it's not that it's not there, it's there, but it's much lower because we're going to send you back someone who's relatively much more stable. But we're not going to be sending you a bomb that's going to explode, and for sure.
Okay, anybody else? Any other questions? No? All right, well, it looks like there's no more questions, so thank you, Dr. T. Anything else you'd like to add?
No, that's all. Just please, everyone, be safe and take this virus seriously. It is serious, and I want to see everyone, do well, and I just want to see all of you guys do well, and I want to see all your patients do well, and just protect yourselves and take as much isolation precaution as you can. Stay out of harm's way until harm dies, and then we'll go back to normal. We'll go back to normal life.
All right, thank you, Dr. T. All right, so now let's do this. Let's, because I set up the meeting until 1 o'clock and we have a good group. So why don't we just do a minute, each one of us, and just tell us how you're feeling, what you're dealing with at this point.